All right, and this is insufflation, correct. And then I also put this stuff in there too. And again, you see me fixing it because I'm very particular about my cords. Anybody got time? Keep going with it when you're trying to get it done. I wouldn't let that hang with you. Alright. So, all this stuff is off my table. Alright, so what are we going to do? Which way do you want to see first? Someone rattle something off.
Indirect.
Indirect? Mm-hmm. What temperature? I don't know these syringes.
Is there some of these?
Yep, that's what's going to do. What temperature card? What type of the song? Sharp, blunt. Sharp or blunt? Sharp or blunt?
Blunt.
Surprise. Bladed, bladed, sharp, blunt, bladed or not bladed?
Blunt.
This is the liquid. I'm just gonna put this up here because that signifies what I'm gonna do. Right? Local, blade, this, jump, good. This. Sometimes I might need to extend the incision, right? This.
You're gonna use something to grab the skin and just use your hand.
Or when they extend the incision?
Yeah.
Oh yeah, but you see, look at that. That's what it is.
Well, you said sometimes they'll just use their hands.
Local blade wrap. Very salient. True. Hassan. Camera. How to put it together. Light cord. So if there's something wrong with the light, if it's dim, whatever, it's the light cord. Okay? A lot of people are looking at the scope and they're cleaning it. Yeah, it's clean. Okay? There's something wrong with this light cord. Sometimes there might be something on the inside of here blocking it, or it just might be cracked and chipped and it needs to be done. Okay? Dim, check the light cord. Again, there's some SMRT people and they're looking at everything else but the light cord. And this is the camera head. Okay. White balance. You get this W, and you get a white part of the Raytec with the blue. Hold it close, the light's gonna come on, and you hear beep. That's white balance. What I like to do after I throw my cords off, I'll white balance my camera and I'll prop it up on my Mayo. Like this part will be on the patient, and this part will be on my Mayo. Because this gets hot, I don't want it to burn the drapes. So if you want to be proactive, I suggest you do that. Because once they get that in, they're going to want to put this in. They're not going to wait for you to white balance it or hook it up. Okay, so whenever you drape and you pull everything up, that's why I like everything in a basin. So I'm going to go up here, and I'm going to lay my cords out. Lay everything out. All the ends that need to go up here, give it some slack, unmark it out, throw off the ends to the circulator. All my cords. I take the drape, clamp it off. What can we use to clamp it off?
Edna.
Huh? Edna. What if we don't have Edna? Alice, Babcock, something like that, okay? So all my cords are here. While I'm doing that, I take my camera, put it on, put it together, white balance it, prop it up on my mayo, because I'm putting my mayo here, right? So everything is ready to go now. Now I have to bring my mayo up, everything is step by step. So we go down through the steps, right? So now, everybody good with this? Do you see the mayo? You understand, remember, you're gonna have packs. You're gonna have a 5mm obturator and trocar that come together that are open together, okay? And then these are gonna come individual with no obturator because you have to reuse this, okay? After you put this one in, take it out, load it for the next one. Local knife this. Like take it out, load it, local knife this. You'll have a few minutes in between because they're gonna take that scope and they're gonna be looking to make sure they're not gonna hit any vessels. They're gonna map out where they wanna put that next trocar. So you'll have like a few seconds in between to get yourself situated. But it's literally like boom, 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 boom. The more you do it, the easier it gets, right? Okay? When you insufflate the abdomen, what is it called?
Yum.
You didn't get it right?
I didn't pick a different word.
Oh, I'm gonna kick y'all. It's alright. It's fine, it happens. Now you will know, you won't forget, right?
No.
Alright, as long as you guys are remembering stuff. It's not that bad. Alright, so now, is everybody good with that? Any questions? Now we're gonna do the anchor. Again, local, knife. Cokers, what do we grab with the cokers? What do we grab with the cokers?
The peritoneum.
Your sutures?
Peritoneum.
Oh, yeah, sorry.
Mm-hmm.
Then
We're
you-
gonna hold that up, yep. Then we're gonna do suture, right? So sometimes they might have you clamp the suture strings off before you put this in.
Says I consider it for the exemption.
Huh?
Would that be considered for the
Yeah,
exemption?
Yeah,
Okay.
you know how I am, like if you put this before this, or you put this after this, I just don't want these to be up here. Or these to be back here, okay? Alright, so you know what these are for. You put this in, you're gonna tag your suture and wrap it around, right? And then, we're gonna do local knife, and then all of these. If your surgeon puts local in all of their port sites, what do you do with the local?
Get it off.
You don't need any more, right? So pay attention to what they do. Some surgeons love to do that because they already know where they're gonna put the trocars. I've seen surgeons take the ruler and map out where they're gonna put their ports as well. And in laparoscopic cases, I count my ruler because it's unused. Okay? So if what they'll do is they'll.
Where would you count it? What would you count it with?
Like when you count your pin rows, or like when you count this, count my softs, my sharps, and then I count all the extra stuff. So what they'll do is they'll mark out their camera port, and then they'll take the ruler and then they'll like map out where they're gonna put their other trocars. Okay. Some surgeons do some both. What else? Simple, right? Yeah. I just need a little bit of a refresher, right? Have any questions? Anything you need more clarification on? Ask away. How many pieces is Fred counted as?
4.
4 or? So when you count it as 4, what pieces are you counting?
The bottle,
The
the
foam,
removable
the
tip,
foam, the
the
white
cap, and the
peely
one.
thing.
So you're gonna count the cap, this, the bottle, and then this piece comes out. So that's 4 pieces. 1, 2, 3, 4. 3 pieces, you just don't count this part. 1, 2, 3. Okay. Again, that depends on your facility. What else you got for me? Sometimes they will use the mets to make the incision bigger whenever they're putting this in. Or whenever they've used the berries, they might need to use some sharp dissection to open up those tissue planes before they can put these. That's not what's it. Okay? This is just a variation. Some surgeons like to use a Kelly to do that. They'll take the Kelly and they'll literally like spread the layers, spread everything open with the Kelly. Okay? Yeah.
The blade in the trocar, would that be counted as a sharp?
You don't count trocars.
Okay.
Unless they are the reusable ones, the metal ones. It'll be, again, up to your circulator surgeon or your facility if you count the pieces in those. But these disposable things, you can count them because you're supposed to count. You won't count the camera head pieces or the camera cord pieces. You're really just gonna count your instruments and then your basic stuff. For laparoscopic cases, if you don't go open, you don't have to count your instruments again. But again, go off your facility's policy. But usually if you don't go open, you don't count the instruments again, it's just socks and sharps. Okay? Anything else? No? You guys better now? Yeah. Kyle's face. Okay.
Learned a lot that day.
Oh, stop it. Alright. You guys are quiet today.
Alright, I have a question for this then. I'm serious, it's a dumb question. Like, I think I'm overthinking something. Do you still make an incision if you're using a blade to trocar?
Yeah. So the bladed trocar, honestly, it depends on your surgeon and the technique that they use. Sometimes they just need that blade to get through the peritoneum. They want to give it another good to get in there. Sometimes the sharp will just do that trick as well. Like if you don't need the bladed. It just depends on their technique. Yeah.
What about for the varus needle?
What do you mean?
Same thing. Do you make an incision?
For the varus needle?
You just put it through.
The varus needle?
Yeah.
So you're gonna take this blade and you're gonna make a nick,
Okay.
big enough for this needle to go down through.
Yeah, that's right.
And then that's why sometimes they might need to extend it because some surgeons will make the incision big enough and some will just make that small nick to fit this down in there. So it'll depend on, that's why you gotta like pay attention to what your surgeon is doing, because if they make the incision big enough, then you don't need that knife again before you put the trocar in. But if they make a small stab incision just enough for this to go in, you're gonna need to extend it more. So for when you're putting the anchoring suture in, because I know I mentioned this, but I'll see if anybody picked it up. Whenever you're closing, will you need another stitch to close those layers with those anchor sutures?
Use that one.
Yes. When you have those anchor sutures in, you'll just use that suture to close it. Because a lot of times they'll leave the needle on and they'll just put a safety on it. Well, they'll like secure it safely so then they can just finish the closure. Or if they take it off, they can use a closing device and close those without using the needle. So if they have that stitch in there, you won't necessarily have to close that peritoneum layer because the stitch is already in there. If they don't have it in, you're gonna have to close it.
Is that what Thompson closure device?
Mm-hmm. Yeah. Yep.
And then there's a different one too. It's like Smith and Nephew or something.
Mm-hmm.
Packaging.
Yeah. So what these devices are, again, I'm not good at drawing, but these devices, they have a blade at the end of it. It's long and it has like handles, okay? And at the end of this is a small blade that opens up. So what they're gonna do is they're gonna stick it literally through the skin. They're gonna go down in, and then they're gonna take the tip and they're gonna grab the suture and pull it back up, and then they're gonna tie it on the inside. So the stitch is gonna be on the under part of the peritoneum. That's what they'll do. Take that device, pick it up, pull it out, take the device, pick it up, pull it out, and then they tie it. It's all on the inside. They'll do the knot and stuff with this device, and then they'll tie it. It's very cool once you see it.
Yeah.
You'll understand. but that's what that is. Some places call it a fascial closing device. Mm-hmm. Yeah. Any other questions? Alright, so you can put their hands on it.